podcast is provided for informational and educational purposes only and should not be construed as legal advice. Because every situation is unique, you should consult with a qualified legal professional for advice specific to your circumstances. If you need legal guidance, please reach out to an accredited attorney or contact us to schedule a consultation. Hello, and welcome back to the Veteran Benefits Podcast. I'm your host, Rebecca Deming. Today, we are going to be talking about a topic that impacts a lot of veterans when they're filing their claims, and that is buddy letters or lay statements. We're going to talk about what they are, how to write a good one that VA finds useful and helps your case, and how to avoid certain tricks and pitfalls that a lot of veterans fall into when gathering their evidence for the lay evidence part of their claims. So let's dive right in. What is a buddy letter? A buddy letter or a lay statement is a piece of evidence that VA can use to help support your claim for disability benefits. So it's important to understand what they are and what they are not. They are not character recommendation letters like this veteran really deserves the benefits. Please sympathize with this veteran. Those don't really go very far. VA wants to sympathize with all veterans, but without the evidence, they can't really award benefits to anyone. So you need to understand what they are. They're piece of evidence that VA can use that fills gaps in the record of your medical records. So they can be statements that speak about something that happened in service, an in-service event, an injury. They can describe symptoms that the person observes, whether you're writing it for yourself or you're getting a friend or a family member to write it or somebody who you served with to write it. They need to talk about what they observed and how they know the information about you. They can talk about the continuity of symptoms. They can give a timeline to how long you've been experiencing certain symptoms if they've actually witnessed them for that full period of time. So who can write a lay letter or a buddy letter? It really can be anybody who has firsthand knowledge of the facts that you're trying to prove. So if you're trying to prove that you fell off the O course in service, having your current spouse who wasn't with you at the time of service write a letter isn't going to get you very far at all because they weren't there. They didn't see what happened. All they know is the stories that you've told since. You can try. It's not going to get you very far. You want somebody who was there with you, or it could be a spouse or a family member who saw you immediately after. So if you returned from a deployment and when you went, you were one way and you came back and they noticed a change in symptoms, whether it's migraines or mental health or orthopedic, joint injuries. If they can say that you didn't have them before and that they noticed you walk with a limp or that you had a shorter temper when you came back from deployment, those can be helpful to kind of anchor something to a specific period of service or something that happened in service. VA makes a difference or a distinction between credibility and competency. So competency is who is competent to provide evidence on something. And for that, VA is looking to kind of your field of knowledge. So if your buddy or your family member or whoever's writing the statement for you is not a medical professional, VA doesn't really care about their thoughts on causation, that this fall caused lasting trauma or that the loud jet noises on the flight line caused your hearing loss. If the person writing the statement is not a medical expert, VA is going to discard those statements because that person is not competent to write statements about causation. They're also, if the person doesn't have a medical background, they're usually not competent to provide a diagnosis. They can say the doctor told us that the person was suffering this, or they can write about the symptoms that they've observed. Saw so-and-so icing their knee. I saw so-and-so have to leave the event to go lie down when a headache came on. Those kinds of things, they're competent to discuss, but they cannot say, well, I know that migraine started on this date because I know what a migraine is. Just because they're a migraine sufferer, if they're not a medical provider, they're not going to be able to provide a specific diagnosis date or a diagnosis in the absence of medical records. But they can write about symptoms that they've witnessed or that somebody has told them about repeatedly. So if you have a good friend that you used to hang out with a lot and you avoid going to things because you can no longer walk long distances and the person says, hey, we we no longer go to the football games because the veteran told me that they can't walk from the parking lot to the football match without pain. I noticed the limp. Those kind of statements are competent because the person writing them is competent to say what they've witnessed, what they've observed, and they're credible. So that's the other piece. So we talk about competency, who's competent to write about something, and credibility. Credibility is a little bit more nuanced, and for that, VA is looking at triggers that something might be made up, indications that something might be made up. So is it credible? Are you providing details, or are you just sort of regurgitating what's in the rating schedule? So if you write something, the veteran experiences frequent and prolonged migraine attacks that are productive of severe economic inadaptability, well, it's clear that you took that directly from the schedule of rated disabilities. It doesn't provide VA any nuance or detail to confirm whether what you have witnessed actually aligns with that criteria. So what would be more credible would be something that really gives detail and nuance and color to the story of what you've witnessed. So very frequent headaches. Okay, well, how often are you seeing these headaches? If the person has social and economic impairment, don't tell me social and economic impairment. Tell me about how their mental health condition is impacting their ability to socialize. Are they getting in arguments? Are they getting anxious and leaving social events? Are they avoiding socialization? Are they irritable? Are they distancing themselves from relatives? How is it impacting social relationships? Which social relationships are impacted? Have relationships with a child been damaged? Have relationships with a spouse been damaged? And if so, how? Those can be very personal, but the more personal details, the more credible the statement is, and the more meat that's there, it allows the rating officers to align your description of symptoms with the rating code. So we're really looking at the total picture of what this person who's writing the letter has witnessed, has observed. In terms of timeline, it can be really helpful to anchor what you've observed to specific life events. So instead of saying, I know that this person has had 2 migraines a month for the past 18 months. Okay, how do we know that that's credible? How do we know that that aligns with the facts? If you can give details about, I know that it started at least this far back because I remember we were supposed to do this activity and it was interrupted because of the onset of symptoms. And I've noticed ever since then, these symptoms have flared up. If you're a coworker, I know that it happens as often because when these symptoms flare up, I have to sub in and take over certain job duties for the veteran. And I've noticed that it slows me down this amount of time. So whatever you can do to kind of anchor stuff to a timeline, anchor stuff to reality and give details, that's going to be very helpful for VA to parse out what's credible, and what you're competent to talk about. They will frequently compare the lay statements to other evidence in the record. So if there are medical records, the lay statements will be compared to that. And so VA sometimes looks for inconsistencies in the records. So VA will look for inconsistencies. And if you know that there are inconsistencies between your medical records and your lay statements, but you know that there's a reason why those inconsistencies might be there, you want to use your lay statement as an opportunity to explain why there's inconsistencies. If you didn't go to the doctor and treat for your condition for years, VA might look at that and say, okay, well, we've got the spouse statement or the friend statement or the parent statement that says that the person has had these symptoms for years, but they've been going to the doctor and they haven't mentioned these symptoms to the doctor. That might be something that you would want to write as the veteran yourself. Why did you not go to the doctor? If you're a spouse, you might want to describe why you didn't report certain symptoms to the doctor. I know there's a lot of reasons why people don't report symptoms to their doctor. Sometimes they downplay them. Sometimes they think that they weren't important. They didn't, for tinnitus, for bringing in the ears, as far as I'm aware, there's really no cure. So I know a lot of veterans say, well, I didn't raise it with my doctor because all my buddies have told me there's no cure. So what's the point in just complaining to the doctor if there's nothing they can do about it? For mental health stuff, I know a lot of people are reluctant to talk to their doctors. And for other physical things, sometimes people are worried that talking to their doctors will impact their ability to keep working in their field. There's a lot of reasons. There's stigmatization. There's a lot of valid reasons. You don't want to just make up a reason. You want to kind of think through, okay, if VA is looking at these statements and I don't have medical records that align with them, I want to explain why there's a gap in my medical records. So that could be a lay statement from you, the veteran. We wouldn't call that a buddy letter because maybe you are your own buddy, but it's a lay statement nonetheless. It's a statement from you explaining these gaps in the medical record. VA will look, if you're trying to explain what happened in service, VA kind of compares it. Obviously, they're going to look for if there's incident reports or if there's something specifically that aligns with that. But they will also look at what your MOS or occupational rate was in the service, where you were deployed, whether the types of things that someone said happened are likely to have happened. So if you get a buddy letter that says that your base was blown up, but your service records show that you were stationed in Oklahoma the whole time and your base was never blown up, VA is going to say that that buddy letter is not credible because they're going to compare it to records that they found. So you want to kind of think about that, to the extent that you can do your research. If there are news articles that show what happened, those are helpful to support buddy letters. But right now we're talking about building out credible, competent buddy letters that VA will, and actually they're required to consider them. And so if they find something not credible or not competent, they don't always do this, but they are required by law to give the reason why they found favorable evidence not competent or not credible. So sometimes we'll see statements in the rating decisions that said, we received the letter that says that XYZ happened. We did not find it competent. We found other evidence more credible based on the totality of the record or based on the types of events we would expect to happen for this veteran in this MOS. Whatever their reasoning is, they're required to give a reason for discounting or dismissing favorable evidence. So having those letters is really helpful. It can fill some gaps. It's not, people sometimes ask, how many letters should I have? Are more letters better than fewer letters? There is no magic number. I will say that having more than one letter can sometimes, from a different perspective, from a different person, can sometimes help VA triangulate stuff. If you've got your pastor saying something, your brother saying something, your spouse saying something, and someone you served with saying something, from different perspectives, they're all witnessing kind of similar symptoms. That's going to add some credibility. VA is looking at the formatting. If you write your letters for your friends and say, can you please sign this? VA is using AI. They are using people. They're not necessarily out to get you, but they are keeping an eye out for stuff like that. So if you use the same wording for all of your letters and just have 4 different people sign them, VA is going to catch on to that. And we definitely don't want to have, even if your intent is not fraud, you're trying, your buddy was there, they witnessed that event, but you're trying to make it easy on them and write the letter for them. I recommend against that. You can kind of give them some pointers of what you're looking for in the letter, but let it be in their own words. That's going to help with the credibility aspect of the letters. So yeah, in terms of the specificity of what's in the letter, the more specifics, the better. We talked about putting dates and tying those dates to specific events, locations. If you just say, well, so-and-so hurt his back in the service, that doesn't tell us enough. But if you say, we were on Fort Hood, it was our second day of this training exercise, and we all had to do the O course. And I remember when we were going over the rampart, veteran so-and-so fell and injured his back. Okay, that's going to be a lot more credible than just injured back in service. Or if it's a kind of a repetitive use injury, sometimes it's not a specific incident, but it's, we used to always carry, sandbags here. We had to lug this equipment. Understanding that the VA rater may not fully understand what your MOS entailed can be really helpful to kind of parse out some of those details on how often you had to carry how many pounds, how the weight was distributed unevenly because you had to carry this other stuff, and what have you. The more detail you can put in there, Not only is it going to be more credible for the rating officer, but those statements should get sent over to a VA C&P examiner to review. And if they can see anatomically how something is more likely to have caused a disability, they're more likely to give you a favorable opinion on their C&P exam, which is likely to get your claim granted. Okay. So in terms of structuring your lay statements, you want to start off by introducing who you are, what your name is, how you know the veteran, how long you've known the veteran, how frequently you've had contact with the veteran, and how you've witnessed the types of things that you've witnessed, how frequently you've seen these things, how you heard about them, did you smell it, did you touch it, what is your basis for knowing the stuff that you're about to put into this letter? And then you want to give specific examples. And again, when you give your specific examples of things, I'm not saying don't read the rating code. Go ahead, read the rating code so you understand how VA rates stuff. It is important, if you're writing a letter and you're trying to get a higher rating for an orthopedic condition and you just talk about how much it hurts more and more and more, VA gives you a minimum 10% rating for orthopedic conditions based on painful motion. They don't give an increased rating if there's more pain on motion. They give you an increased rating if you have limited motion, more limited motion, and that could be because of the pain or because of other factors that limit your range of motion. So it is important to look at the rating code, but when you write the details, you want them to be specific to that veteran. I think personally, I don't mind a little bit of humor or a little bit of realism in these statements when they're appropriate. If you're talking about a sinus infection, you're trying to describe how often your sinuses swell up and your face gets full of snot and boogers. Those kinds of statements are real. Boogers are not in the rating code, the schedule of rated disabilities. So if they're words that you use, I think it makes it more relatable. We had a statement once from a veteran who he had rope burns on his hand from sliding down in an exercise, and he hadn't gone to the pre-training. And so he wrote a statement about how he'd missed the training because he had to go take an educational course. And he got up there and his sergeant made him do the exercise anyway. And when he came down, his sergeant was like, "Why the hell did you mess that up?" And he said, "Well, I missed the training because I was in another course." And the sergeant goes, "Man, you've got balls, son." And he put that in the statement, and that's realistic. I mean, not that you have to put that kind of stuff in every statement, but the more humanizing you can make the statement, I think the more credible it is, as long as it's realistic and it actually happened, and you're not just making up details to tell a better story. VA will poke holes in that, but if you can add some color to your statements, you want to make it sound like it came from someone who witnessed the event, not like your lawyer wrote it. We do get questions from our clients sometimes like, "Can you just write the statement for me? I hate writing these. I can't get my buddies to write them. Can you just put in what we need?" And we will talk our clients through exactly what we're trying to prove in the case and what details are going to be the most helpful for their case. But we're not going to write the statements for them because it really does need to be in a person who witnessed the event or has knowledge about the symptoms. It needs to be in their own voice. So just to recap, some of the common mistakes are thinking that this is a character reference, saying, this person is really deserving, VA should take care of this person, they really need it. That's not going to be very helpful. Keeping it vague or just referencing the schedule of rated disabilities is not going to be credible enough to get you very far. Speculation. So again, if you're not competent, if you say, "Well, I think this is probably what caused the PTSD. I think this is the most likely time that so-and-so broke their ankle." What did you witness? What did you observe? Don't speculate on the cause. Give enough of the pieces that you've witnessed and let VA draw those conclusions themselves. Exaggeration. If you're trying to go over the top and stuff doesn't align with your medical records, VA is going to catch on to that and it's going to hurt you in the long run. And not giving a time frame. I'm just saying, the person suffers from these symptoms. It's going to be harder to tie it back to service. It's going to be harder to show that there was continuity of symptoms if you're not able to kind of tie what you've witnessed to frequency and length of time. So I think lay statements are sometimes underrated. Sometimes people don't use them, they don't know how to use them, but they can be a really powerful piece of the evidence in telling the story and tying the dots together, especially when a veteran didn't go get as much medical attention as, if you have everything documented by your doctors, then that's great. It's going to make it a lot easier to prove stuff because you have continuous treatment records. But missing those records, or if an event happened in service and it's downrange, or for whatever reason it didn't get documented, having lay statements of people who witnessed that stuff is going to be really, really helpful to proving the elements needed to win your case and get you the benefits that you deserve. I hope you found this helpful. If you have questions, please put them in the comments. If you have suggestions for topics, please put them in the comments. Please like and subscribe and follow us, and stay tuned for the next episode. Thank you, guys.